Good morning, I'm Holly Bowens, and I'm here to give a presentation on the Zika virus and how it affects the migrant and undocumented workers that we have here in Austin. The Zika virus is a single-strand RNA virus and is primarily transmitted by mosquito bites. 1 in 5 people infected will have the symptoms of a fever with a rash. They'll have aches, pains, they'll be tired, they'll have conjunctivitis, headaches. They could possibly get Guillain-Barré syndrome, and the babies could get the fetal microcephaly. The diagnosis timing is the key since there's no preventative vaccine, no medication. The incubation period is unknown. The clinical presentations is how they're usually diagnosed from having a recent travel to the affected area, sexual contact with an infected person, and lab testing will be done to diagnose it. The fetal ultrasound can be done, amniocentesis, and a postnatal test on the placenta for the virus. Prevention or the mosquito prevention strategies is to avoid traveling to areas where Zika is there, wearing the long sleeve shirts and pants, repellent with DEET, remove standing water, stay inside with air conditioning and screens, use of condoms to prevent it from being spread to unborn children, and you don't donate blood for 28 days. Migrant and undocumented workers are at risk because they have a history of travel to the Zika-infested areas. They spend time outdoors working as farmers, landscapers, painters, construction workers, and mechanics. Unprotected partners, sexual partners can be at risk. Pregnant women, and the unborn children. The risk is high in undocumented workers because there's 10.8 million undocumented immigrants living in the United States, and most are described as young, poor, uninsured, low education, not proficient in English, and they're from the areas of Mexico, Central, and South America where the virus is prevalent. The percentage of minorities for the Hispanic population, the most populous are at Miami has 70%, the state of Texas has 55.2%, with Starr County, Texas has 95.7%, which is the largest amount per capita. California has 60.3%, and Los Angeles County, California has the largest amount with 14.4 million persons. Here in Austin, we have a 34% of Hispanic, and this is compared to the African American population over here. In Austin, this one is a map of the breakdown of the concentration of where Hispanics live, and as you see, it's south of the lakes area here, and this is where our hospital is. We're the only hospital in South Austin, and we take care of this population. This is our community. The social detriments form is availability of food, clothing, and shelter, access to education and jobs, access to health care. This is true because the undocumented workers are not qualified to have Affordable Health Care Act. Availability to community-based resources, transportation options, safe communities, language and literacy, and culture. How the Zika virus spreads in the community here. I've chosen the agent-host environment epidemiology model. The agent is the Zika virus, the hosts are the mosquitoes, and the environment is the climate here is warm. We've had a lot of rain this year. It's mosquito season. We have standing water and tall grass, which are the breeding areas. And we have the human population where there's a lot of crowds. They're outside. And the socio-economic factors, the uneducated on Zika and the protection needed, and the working conditions that we have here. The transmission risk, as you can see here, there's preventative phase where there's the vectors possible in the state. Level 1 is the mosquito season, where the introduction of travel-related, sexual, or other bodily fluid transmission. 2 is suspected or confirmed incidents is a confirmed local transmission of a single local acquired case or cluster of cases in a household, and they're less than 2 weeks apart. In the incident response, level 3 is confirmed multiple person local transmission onset greater than 2 weeks apart and a mile apart. We're in level 3. The community assessment here in Austin, Texas, the staff have identified 244 persons where they've sent off to be tested for Zika, and 57% of those were pregnant women. The results as of today, August the 5th, for 143 persons, 4 have tested positive for the Zika virus. Testing results are pending for 39 persons, and 62 additional specimens were unable to be tested. But there's no report of severe illness or death from Zika in our area. The hospital assessment, I did the initiative questionnaire, and our hospital system scored a 44 out of 44. So we are ready to be leaders in the fight against the Zika virus. The St. David's Foundation provides funds to programs to help the community as per our mission statement, and we have 60 nonprofit partners that can help with this initiatives. The community health diagnoses, or the nursing diagnosis, is deficit knowledge related to illiteracy and or language barriers. And priority will be given to education to prevent the deficit of knowledge. Evaluation will be the patient understands the need for Zika prevention and the number of Zika cases will not increase. And the second diagnosis is risk of the Zika virus is evident by vulnerability, exposure to the mosquito bites. The risk for the Zika will be reduced by the preventative interventions of the DEET spray, preventative clothes, no standing water, and the use of screens on the windows. The Healthy People Objectives 2020 is increase proportion of population-based objectives for data on available to the race by race and ethnicity, and access to health services. So it's going to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary health care. Proposed interventions is for primary prevention. It's the informational sheets and quick cards for the Zika virus in both Spanish and English to be distributed at our community services from the CDC and the OSHA websites. The information videos in English and Spanish about the Zika that'll be played on the hospital's information channel, and it'll be offered to the physicians to play in their waiting rooms, and educate on the use of condoms to prevent the spread to the unborn child. The primary preventative measures for the workers are listed here, as we went over a while ago. Reduce standing water, wear the proper clothing, and use the insect repellent with DEET. And one thing here is if the workers start showing symptoms of the Zika virus, they need to let their supervisor know immediately and get medical attention. This is a copy of the Zika virus quick card by OSHA that will be given to the workers. And this is the primary preventative intervention for Zika in Spanish that talks about how it's sexually transmitted and the use of condoms. And this is a handout in Spanish that talks about the preventative measures for getting to help prevent Zika. Potential barriers, disbelief that it can affect you, little or no access to health care, the language barrier, illiteracy, unable to control the mosquito population, the cost of the educational materials, and the ethical issue here is the religious beliefs to prevent the use of condoms. The community readiness, Austin, as of today, August the 5th, the Zika prevention kits are going to be provided in the areas where there's been a confirmed Zika case, and the kits are going to contain the DEET mosquito repellent, condoms, and fact sheets, and they're going to have an environmental assessment of the home and surrounding areas. This logical model shows the inputs of staff, money, materials, partners, and resources. The outputs are the handouts of the community events and videos to be played. Participants are the family and the communities, the migrant and undocumented workers, and pregnant women. The short-term outcome is increased knowledge of the link between Zika mosquito bites and the increased knowledge of the link between Zika and the microcephaly, and an increased knowledge that Zika is found in bodily fluids. The medium-term outcome will be monitoring the number of Zika cases, monitoring the babies that are born with microcephaly that's linked to the Zika virus. And the long-term goals are to reduce the number of Zika virus cases and reduce the number of babies born with a Zika virus-linked microcephaly. And the evaluation plan, the plan interventions we evaluated by people in the community understand by use of the Z products, the mosquito control measures, no new cases of Zika virus, and no cases of babies born with a microcephaly. Justification for this is the cost of the materials for the handouts and videos will be justified if just one baby is saved from contracting Zika virus that's linked to microcephaly. My call to action is, ladies and gentlemen, we are facing a potential pandemic with the Zika virus. Austin has 4 confirmed cases, and with it being mosquito season and people traveling all over the world, we need to use the preventative interventions I've outlined for you here today immediately. We need to educate our community on the dangers of the Zika virus and help them prevent the spread to others in our community and future generations. My executive summary is to educate the staff and community on the Zika virus, have the handouts on the Zika virus in multiple languages from the CDC, give the handouts to people at the community events, make a Zika virus information video in Spanish and English, play the video on the hospital monitors and in-room education channels, offer the video to the physicians' offices, and educate the community on the importance of condom use if potential infection. Thank you for your attention on this important issue. The next 2 slides are my references. Again, I want to thank everyone for their attention today, and I look forward to having y'all help me and partner in helping to prevent the spread of Zika in our community here in South Austin.